Well, this is particularly a session that has been kept out of the way, displacing other sessions, because of late I've been receiving number of calls. Perhaps how to prepare for FNB. Is FNB really worth going? And then, of course, asking me what to expect in the paper, and perhaps how to utilize that last leftover bit of time, those last couple of months you have to maximize your result. So, keeping these things in mind, I'm here in front of you and I'll try presenting to you all the information I have. But you are free to ask me also if any queries in your mind regarding this exam. You can type your query in the chat box. The chat box is right in front of me. I'm constantly looking at the chat box for any of your comments. So I'll keep answering also side by side if there will be a comment. So I'll just begin up by, uh, letting you know about the a brief introduction to this FNB paper. I did my FNB in 2014, so I was the first candidate for sports medicine. And since then, I've been following this exam to this time, coming up exam in 2024. So I've been following this exam, so I just know how the patterns have changed, and how the not just the pattern, the type of questions, the difficulty level, everything has changed. Now, as of today in this exam, you will have to face 100 questions, the exam that's coming on 18th of February. And please pay attention here. What I have observed, the big change since my time, that almost 20% of the paper at least tends to be now image-based questions. So while you are preparing, keep looking at the images also carefully. Now, there will be 4 marks awarded for a correct answer, and there will be 1 negative marking for each answer. Now, 4 marks for each answer, so it's a 400 marks paper. And around 270 is a good score. This will keep you within 50 ranks. It's a very good score. Now, in order to get this score, your target will be to attempt something around 90-95 questions at least. And out of these 95, you can get 75 correct. You will be almost reaching this margin. So I'm focusing this whole discussion so that you are able to cross this 75 mark here. Now, what about the break part of this paper? Now, these 100 questions that you're going to get in the FNB will be broken down into part A and part B. Part A will be 40 questions. Part B of the paper will be 60 questions. There's a separate time allotted to the 2 parts. Part A questions, you will be allowed 45 minutes for it. So little more time here. Part B, it's neck on neck, 60 minutes for 60 questions. It's small break in between the 2 sessions. Now, as per the guidelines given in the booklet, this part A is supposed to have questions from general ortho and neurosurgery. And part B will be specialty specific, whatever you apply for, trauma FNB, hand FNB, whatsoever, or sports medicine, arthroplasty, spine FNB. Now, this is the most popular FNB paper given by most of the students. And sports medicine, arthroplasty, and spine, is clubbed into one part. A single exam, you get ranks, and you can pick up a seat in either of the 3 branches as per your convenience, as per your ranking, as per the choices. Now, your specialty is supposed to be 60 questions, and general ortho neurosurgery is supposed to be 40 questions. This will be part A, this will be part B. Please, this is what is given in the booklet. I have been taking recalls and asking students since last few years. Practically, they have seen a lot of overlap. What I mean by that even in the general ortho part, there will be an arthroplasty question in the paper, or maybe a sports medicine question in the paper. So what I'm trying to say, what I could make out, that what NBE has done, that they have tried that the student sitting in front does not have the same paper as the student sitting at the back, so that they cannot cheat. So likely they have jumbled up the questions. So that is why that strict distribution, that part A would only have general ortho questions, is not there. But yes, when I seen the breakup of the paper, by and large, what I have realized, that yes, around 40 questions come from this much of domain, and around 60 questions come from this much of domain. So the distribution is almost followed, but the distribution is not presented exactly in the paper as you think like. The idea is very simple to convey this information so that you're not puzzled in the exam. When you start doing general ortho, you suddenly start finding arthroplasty or sports medicine questions. But net total distribution will be pretty much as per the NBA experience. Now, people have often been asking me, sir, how much pediatric orthopedic questions is that also important? Or what about these tumor questions? Now, there is no separate FNB for pediatric orthopedics or tumors or oncology, I would say. So these things get included only in the general ortho part. Technically, this part will not have any questions for pediatric ortho or tumors. Getting it? So the weightage for pediatric orthopedics and tumor is relatively less. But then, in order to make sure that you maximize your results, I would give you the exact breakage only. The exact breakage, like what is the breakage for all the questions. So this is my experience over last, almost like 7, 8 years now, as I followed up the changing pattern. So this is how the pattern has been consistent since last 2 or 3 years. Now, this is the general ortho part, and this is the specialty part. Neurosurgery is like, again, a very overlapping domain. Part of it is like polytrauma or general surgery questions. That could be even orthopedics also, like chest trauma. Part of it is strictly neurosurgery. Now, first, let me take up this general ortho part. There will be almost 5, 6 questions from hand microsurgery and nerve injuries. In pediatric orthopedics, 4, 5 questions. Now, these 4, 5 questions are generally basic. Like last time, Otolani test was asked. So they were very basic. A question was on clubfoot. Tumors, 5 to 6 questions were there last time. Now, again, this is a very dicey zone. There was a couple of questions from tumors in spine also. Now, you can take it under the spine heading also, tumors also, but tumors, you will have 4, 5 questions. Basic sciences like calcium metabolism, PTH role, 3, 4 questions. If you subtract this up, out of those 30, 35 questions of general ortho, 10, 12 questions will be strictly from trauma. So that fracture area just forms 10, 12 questions. Not as important, I would say. The problem here is why they just form 10, 12 area, because this FNB sports medicine arthroplasty spine has also been allowed to neurosurgeons to appear. So a domain goes to neurosurgery also. Now, on an average, since last 3 years, we have been having around 5 to 9 questions from neurosurgery. Like spine question can be taken up as neurosurgery question also, or maybe spine also. So if I just, neglect that overlap, you should prepare to deal with 6, 7 questions strictly of neurosurgery. This neurosurgery part, vascular malformations and those EDH, SDH trauma part, that will be one part. Brain tumors will be another part here. And bit about cranial nerves. So these are 3, 4 domains from which questions are generally asked from neurosurgery side. Dr. Himanshu and Dr. Mohit have already recorded this part as lectures on Target Ortho, and that PDF is also available with the lectures. So make sure you go through that area, because you cannot neglect 6, 7 questions. That forms a heavy part in a paper that is just having 100 questions. So in a way, this turns to be a game changer. Now, as far as this specialty part is concerned, now please see this sketch here. Very important. When I gave my exam, sports medicine questions used to be nearly nil. And there would be almost 50, 20 questions from arthroscopy part. Now, over the last 2 or 3 years, the trend has reversed. You would be surprised to know last to last year, there was actually no question from arthroscopy. It was only strictly sports medicine. And last year also nearly nil. Arthroscopy just 4, 5 questions. Predominantly, it was sports medicine. Now, sports medicine, please don't mix with arthroscopy. Sports medicine deals with the exercise physiology, like what component you would use to do an exercise, what sugars would you burn, how much fat will you burn, that Krebs cycle, that glycolysis. Sports medicine, of course, deals with rehabilitation also. Sports medicine also deals with drugs and doping, again, a very important part. This particular part is again in a very detailed manner taken up by Dr. Shikha on Target Ortho. And no way can you even think of attempting the paper if you are not having some hold on it. Priyanka has repeatedly shared some short books also on sports medicine in the group. Okay, and then Target Ortho question bank covers up a lot of material on sports medicine. Please make sure you don't miss these 15-20. I think with time now, as you know, more and more people are realizing that sports medicine is, following a greater trend. More questions are coming. So people are focusing more here and neglecting arthroscopy. So my expectation is that, FNB has been always surprising students. So do expect some more questions of arthroscopy this time. Last to last year, it was practically in the last year, some questions came up. So now I think this part could go in a well-balanced way. Last to last year, I think so much of sports medicine was there, even replacing arthroscopy, perhaps to surprise the students and to attract their attention towards sports medicine. So be clear about these two very deciding areas. Spine again forms a very detrimental part. People who are not good with spine, they end up losing huge margins. Expect 15 to 20 questions of the spine. Dr. Vishnu is very effective out of spine, and most of the lectures will be good enough to tackle almost all questions of spine plus the target ortho question bank. Arthroplasty would also separately have 10-12 questions. Questions not just span hip and knee arthroplasty. Please, you will have questions on gap balancing in knee and type of implant in knee. There was a question last time. Those kind of things will be there. But there was a lot of predilection from the examiner asking you about ankle arthroplasty, elbow arthroplasty, shoulder arthroplasty. So last time there was a question each on shoulder, elbow, and ankle arthroplasty. And there were two questions from shoulder arthroplasty. So please don't think of arthroplasty as only like an arthroplasty of hip and knee. Repeat questions from last 10 years. I'll be coming to it. I'll be coming to that repeat also. Okay, I'll be just coming to that repeat part also. So repeat questions would generally make up, around 30% of the paper. So I'll just talk about it. Don't worry, in a while. Now, regarding these questions, I must share the difficulty level with you. Most of you must have given your SRship exams at times or appeared in some other exams also. FNB will be certainly much more difficult than these papers. Okay, this recording will also be shared. Yes, Praveen, it will be shared. Okay, yeah. And Dr. Susruta, I'll be talking about the repeats also in a while. Last 10-year papers and where they are all available, I'll be sharing that information in a while. Okay. Now, regarding these questions, I must stress upon the difficulty level. The difficulty level is extreme. Trust me, even if I'm a faculty, I have to sweat to find the answers. Writing down the answers to the explanations to those FNB questions takes me at least 2 or 3 months. Sometimes it is damn difficult even to find the answers. So the difficulty level will be almost over and above all these routine exams that you have given. But yes, you will go through the mock test they'll be put to you. You will realize they will be almost of the same difficulty level. So make sure you appear in the mock test to get a taste of the type of questions that will be there. The mock test will also have some repeated previous year questions, so we'll get to know what kind of difficulty level was there. But expect the questions to be difficult, and that is why the cutoff goes almost as low as 40%. 65-70% is almost like topping the exam. So even if you find the level to be difficult, don't lose your morale. Stay focused because everyone is finding it difficult. Okay, but yeah, if you prepare well, you will be into that 70% score and you will be through. Okay. So you joined as an FNB and got a spine seat as well. But you quit the course because you are eligible to give the exam again this year. I'm not sure if you left in between. I think you are not eligible for another 2 or 3 years. There is a guideline, but check it in the booklet because these guidelines tend to change. But I think you will have an eligibility issue if you left the seat in between. Okay. Yeah. So part B for trauma, I'll come to it. I'll just come to it that in a while about trauma and hand microsurgery also in a while. Okay, Chinmay? Sure. So I hope you've gone through the breakage. You've got to know how much will be that cutoff score to appear in the counseling. Okay. And the difficulty level will be high. All right. Now, Chinmay, your question, your query. FNB exam traditionally has been conducted in three specialties. One is spine, sports medicine, arthroplasty, and I've been mainly focusing here because this is what's comprising 90% of the participants. People who are preparing for FNB, so 100 people, 90 will be giving spine, sports medicine, and arthroplasty. Now, apart from it, FNB exam is also conducted in trauma and acute care surgery, hand and microsurgery. Okay. Now, I'll like to brief a little about these two specialties also. Part A in even these two specialties is same. So part A is same for all these three specialties. So all these three specialties will have the same 40 questions. Those 60 questions will be different. Now in trauma part, that part B, this is focusing a lot on surgery part, abdominal trauma, that polytrauma, that emergency trauma, and a bit more of neurosurgery here. Okay. Trauma FNB actually has been designed to deal with acute trauma in the emergency. So that emergency-based procedures form the main domain. And here also, people have been finding questions bit of arthroplasty, spine, and sports medicine. Those questions form 10 or 20% of the past part. But yes, 70-80% cases were trauma. But there was a bit more of neurosurgery, polytrauma part. And of course, those normal 10-15 questions of trauma were actually like 30-40 types. Hand and microsurgery part. Now here, it's a lot of plastic surgery that comes in, flaps, dressings, and of course, those vascular repairs, polycization, and those kind of procedures. And here, a lot of questions on nerve injuries and tendon transfers. Okay. So this is what forms that part B questions, but part A will be same. So even if you're appearing for hand, expect some questions on pediatric ortho, expect some questions on bone tumors in that 40 part wala domain. Okay. So I hope that part is clear to you. Part B here. Chinmay, is your query clear now? So what will be part B here? So part B will be separate, but what you have to deal with, I hope you are clear. Now, what is the scope of getting a good seat here, good rank here? And what's of course the scope of FNB? So first of all, suppose you have a rank under 90, you can rest assured you can get some kind of a seat in spine and sports medicine. The spine sports medicine seat almost go down to rank 90 or 100 once all the counselings are over. Trauma, up to rank 15, you can expect getting a trauma seat somewhere. And hand, almost everyone gets it because number of seats generally equalize the number of candidates. And sometimes some people who even give this hand and clear up, they pull out. So hand people are most comfortable. Okay. So these are the ranks to which this seat goes. Now, suppose you are opting for FNB. Please be clear with two very specific things. What is like the status of FNB, the scope of FNB in the market. Now, if you're doing FNB, you are doing a recognized super specialty by Government of India. 2016, a gazette notification was taken up by Government of India. In the gazette notification, it was mentioned clearly that FNB is being given the status of super specialty, and it will be a registered super specialty with your medical council. Like I did my FNB and I'm practicing in Delhi in Suffering Hospital. On my DMC certificate, my Delhi Medical Council certificate, my FNB is registered as a super specialty. Okay. They clearly also mentioned here that even if you're doing FNB in a teaching institute, like I did my FNB from sports injury, which is part of Southern Medical College, your teaching experience will not be counted. Okay. VMMC gave me a teaching experience letter, but that was denounced when I paid for my UPMC intern. And the gazette notification also clarifies that teaching experience will not be counted for FNB. Yes, surprisingly, I also gave AIMS interview once, and they are a deemed university. They are a university in themselves. They counted my teaching experience. So counting the teaching experience basically goes to the selecting authority. But if they don't count your teaching experience, you cannot fight for it because the gazette notification clearly says that this is not legal to count the teaching experience. Clear with that part, guys? No, very commonly people, ask me this part also that, I just finished my PG or I'm 1 year down the line as an SR. So should I continue with FR and study at MICE? No, I would first say that you do FNB and now you go and do a fellowship or you go and do a senior residency. The channels are open because it's easier to pick up the two choices. But the reverse is not so. Like you're done with the fellowship and any day you cannot pick up an FNB because there's an entrance exam that is difficult. So keep always FNB over and above the other choices. See, there is a lot of congestion right now in the orthopedic market, unfortunately, rather than the surgical market. And that's why hardly you find even the PGs taking up surgical branches. No one top 100 elite PG took up the surgical branch this time, barring few girls in line. So in a very simple way, because of the congestion, you have those 5, 6 years before you settle up in a practice. Perhaps FNB should be given preference every time you are getting, you can go and do maybe professorship. Like I left over after FNB, which was fairly easy exam. Now with FNB, a very distinct advantage over maybe fellowship or SRship or anything. I think there's a break in the. Okay, I'll just have to go back and reconnect my tablet. Okay, net has just have to connect again. Sorry for a small interruption, guys. I just need 2 minutes, 3 minutes to be back. Okay, I think I'll just exit. It's showing up. Yes. Just need to share the screen now. Yes. That's it. Sorry, minor interruption. Yeah. Okay. Can FNB apply for consultancy in medical colleges? Yes, yes. You can apply consultancy in any medical college. Okay, Vipin, there is nothing in it. But yes, if you're applying in medical college and they are requiring some teaching experience, the teaching experience would not be counted. Okay, fine. Now I must clear to you this part. So why I was saying FNB is better than maybe a fellowship or something. So first of all, the teaching part is very structured. NB has very fixed guidelines. So timely, you will be taught about few things and that assessment will be conducted even by NB or by the local authority where you are doing the FNB. Some things have to go into research part also. You will have to maintain a logbook also where what all you did in that time has to be recorded by you and that logbook is to be submitted in the end. That assessment will be at the all India level also and there'll be an exit exam also for which you will study. And somewhere down the line, that litigation part also goes down. If you do that extra degree, once you are through with the degree and you're doing a case in your domain, uh, so that wise, I practice at subject hospital after this, and perhaps difficult to get arthroscopy in your hand at a junior level. But when you present a degree, very hard for the senior to stop you as well, getting it, and they trust you as well because you are thorough with the field. So those kind of advantages come from the curriculum part. The stipend and fee is much better. There's a minimum stipend mentioned that is around 45,000. Rest depends upon the institute. And most of the institutes are giving over and above 45,000. Sufficient almost gives the stipend of a normal SR, which is over and above one. Otherwise, 60, 70,000 is the average stipend you get, which is very hard to find in a fellowship. The hands-on work, well, let me tell you guys, I would apologize. It is limited both in SR-ship or fellowship or FNB as far as these domains like spine and arthroplasty and scopy are concerned. But still, the hands-on in FNB is better than, you know, to a fellow or to someone else, because you end up spending 2 years and reading 2 years at one place. So some kind of a trust always comes upon you. So that's one thing. Okay. Do you need to leave your job? I'll be coming to it. Okay. Now, while there is no thesis, Rajesh, in FNB, thesis is only for those degrees where 3 years are there. In any degree that spans 2 years, there is no thesis. So a 2 years degree is what is called FNB, and the 3 years degree is called a super specialty degree, DNB, super specialty it could be, or DM or MCH it may be. That goes to NEET exam, and 2 years degrees come to FNB. No FNB has that requirement to do a thesis. Okay, fine, all right. Any queries still here? Okay. So, do you need to leave the job or no? So let's talk about it here. So with 8 to 10 weeks to go, so what is the material that is must know for you? So, I don't think you need to leave the job, but you need to be a bit more structural, programmed, and disciplined. That is what I would say. Most of the times, and I've been taking interviews of all the toppers in last 3 or 4 years. Fortunately, we've been privileged to have all the toppers associated with us. So what I observed that what they did was that they were very focused and disciplined, reading little each day and giving that much of time. You have to see the nature of your job. You would require at least 6 to 8 hours a day of study and on a constant basis. So if your job is draining you too much that you can't give that much of time, then think of leaving the job. Otherwise, you can just continue the job. Clear with that? Cutoff rank for an arthroplasty seat. Well, it is very difficult to define the cutoff rank for arthroplasty or spine or arthroscopy. Arthroscopy, I can. Somewhere around 20, 30 it finishes. But arthroplasty spine are very variable. But eventually, till the rank of 90, you will end up getting either of the two. Arthroplasty could finish at, say, 70, 80, and spine maybe at 90, or vice versa either. It just depends upon the preferences students offer. Okay. Can you brief on MCH exam? Well, no point of talking of the MCH exam. Also, I've already taken sessions for NEET SS and INISS and the interviews of the toppers. They are already there. The NEET topper was with us only. So in that interview, you will get to know all about this. But right now, the MCH exam is not coming. It's already over. So you can watch that up for your clearance. Okay. Okay. Last 2 times you wrote FNB. Most difficult part was sports medicine and neurosurgery. So I've already told you, Rajesh, for that part, the question bank of Target Ortho will help for sports medicine neurosurgery. Some books we have shared on the groups would help, and the lectures from this area would help you a lot. Last time also, things that were discussed in that last lecture by Dr. Mohit, high points on neurosurgery. 2 or 3 questions came up from that lecture only. So you can just go through that PDF. It carries a lot of high material on neurosurgery. Okay. There are 6 seats for hand and microsurgery, but seats might change in every matrix. But Sachin, by and large, the number of candidates appearing are also 8 or 10 in hand and microsurgery. Okay. Fine enough, guys. All right. So let me now come to the golden part. What is my advice for this last 8 or 10 weeks, 2.5 months you have? So 18th of Feb is the exam. Okay. So how to best utilize that time? Now you were asking about repeat MCQs. After scanning through these papers, I would say the repeat part is somewhere like 30 to 40%. Now, that's a heavy number. 1/3 of the paper is repeat. Now, I would not say that strict repeat. You won't get a mirror image of the question, but it would be almost a question from the same topic, just twisted a little bit in that way. Okay, like very simple. They have shown you an implant and they ask you what type of an implant it is. The answer is a posterior stabilized knee. Now they could show you an implant and ask you what type of an implant it is. It could be a cruciate knee. So you would find almost the same topics that are asked, but little change in those questions. A lot of people on the group get put up those questions, that IV fluid wala question or something, 2 questions with different answers and those kind of things, because they were so closely linked questions. asked in two different FNBs, almost from the same topic, with that might change. So repeat will form 33% of the part, and target of the question bank is particularly important here and gives you that distinct advantage, covering up all these recalls, whatever we could gather based upon the method. Okay, image-based questions will be around 20%. I've already spoken about it. Last time also a lot of images. Last year also a lot of images. So this pattern got set about 3 years back. Prior to it, it used to be very simple paper. So 3 years back, it's been a very consistent pattern, around 30% repeat and approximately 20-30% image-based questions. Fine. And there were images of clinical tests, like Otolani test image was there, and and Ali's test for rectus femoris tightness, that image was there. Okay, so images of clinical tests, images of MRIs were there, TB spine paradiscal image like that. Okay, so images of X-rays were there, that loose knee image and knee replacement, and then that prosthesis of a TKR. So all those kind of images were also there. Fine. Okay. Now about the study material. So first of all, you have to make sure you go through the question bank and target ortho first and foremost. At least you take down these 30-40% questions. Now, you must go through the lectures also. Now, with this much of time left, Target Ortho offers you a speed facility at what speed you want to watch. Watch them at a faster speed. Try watching 1 to 2 lectures a day. 2 lectures a day is a very good, speed. Make sure you go through the spine lectures by Dr. Vishnu. Now, Dr. Vishnu has sometimes repeated the same topics every year. So even if you check spondylolisthesis, there'll be 3 or 4 lectures, but watch the latest one. Whenever we take the latest lectures, we try to include previous year questions or some updates into it. So make sure you go through all these spine lectures. Make sure you go through all the arthroscopy, arthroplasty lectures I have taken. Trust me, there have been direct questions from what I've spoken in my lectures at times in the FNB paper. And the lectures are kept taking in mind, that the FNB students will be watching it. Make sure to watch the sports medicine part taken by Dr. Shikha and the neurosurgery part taken by Dr. Himanshu. I have received bad feedbacks mostly on these areas. Perhaps I think not because the teachers are bad, perhaps because we are not very much interested in these areas. Getting it, so it's hard to absorb and hard to understand. But please remember a fair advice from me. It is hard for everyone in these areas because routinely we are not, adapted to reading and practicing these areas. So doping will be a hard domain to understand, like so much of depth in doping and that way. So do watch them with a discipline in your mind that if you don't watch them, you'll end up losing marks because eventually they will form a good part of the question paper. So these are the must-watch lectures I would suggest for you because this is eventually going to form 70-75 questions, and that is what you are targeting, 75 questions correct. Clear with that? Okay. Yes. Apart from it, what all things you are supposed to read, I'll come to it. But let me talk about study material for trauma, polytrauma, surgery, neurosurgery questions. In I'll talk about it. Last year, some questions were purely about general surgery. Yeah. So that's what I'm telling you. That in hand part, it will be plastic surgery, general surgery, uh, more. But then I think it's equally for everyone. I hardly find plastic surgeons or general surgeons giving it. So all orthopedic surgeons would have that fair deal. I think you need not worry much about these general surgery questions if you are giving FNB hand because competition is very low. So you will end up getting it. Fine. So you won't find that much of struggle. And don't waste time reading so much of surgery. That won't be eventually that much beneficial to you. Okay, Bhargav? All right. Study middle for surgery and neurosurgery and polytrauma. Well, that's all covered on Target Ortho. Okay. General surgery part in arthroplasty spine is very low. Maybe one odd question or two odd questions. That's it. But neurosurgery will be there and that's well covered. All relevant syllabus of neurosurgery is covered with Dr. Himanshu and Dr. Mohit's lectures. Okay. Yeah. Now about the supplementary reading material, because people often tell me that we have been attached to Target Ortho since maybe 4 or 6 months, and this is already done by us and we have watched and we are done with it. Now, if you're done with this much of part, let me share some sources from which I think the questions were picked up. Miller's is another thing. from where I found some lines were directly picked up as I prepared up the recall, because I eventually prepare the recall and jot down those answers. So there was something directly picked up from Miller's I found. You can try giving a read to Miller's. Then ortho bullets, some selected areas have to be read. Some MCQs were even picked up from ortho bullets. Sometimes an MCQ was not picked, but an image from a question was picked and a separate question formulated. So those kind of things were there. So that's another good source. But ortho bullets is too wide, to complete. Read it in a selected way in areas where you are weak. Then AOS books have specifically been shared in the group because at times I have observed some questions coming from this source also. Okay, so these are some add-on sources I would recommend. Now, some students have posted some books of FNB recall and those kind of things on the group, and to which I had strictly written not to follow those sources for an FNB recall. I would tell you the very simple reason. Most of these recall sources are false. In fact, I also purchased few of them in order so that we can improve our question bank. But I have been, getting that recall directly from the toppers who've been associated with us. They've been sending me all the papers, and the recalls are not even near to matching that which the toppers have been sending me. Sometimes even in these books, you will find five choices when FNB is all about four choices. So don't waste time on those kind of books. The biggest problem is accuracy. Many of those books are not accurate also with the answer, and the explanations are also not correct. So avoid wasting time, because with this much of time left, time is one of the deciding factors that's going to play out. And yes, even if you can't go much into the supplementary material, doesn't matter. Focus more on revision. Even if you're thorough with this much of material, very high chances that you will be through. Okay, fine. In Target Ortho lectures and questions, dividing to enough. Yes. So I would say that if you're through with the lectures and you revise the bank 2 or 3 times, a very good chance you will be into that 90 part, 90 ranks where you can get a seat. But idea is to have a better rank, or your target is always rank 1. So add on some supplementary material. I have given you this flow chart only in what direction is the supplementary material supposed to be added. First, go through quickly whatever part of Miller's you can. Then, maybe add on some material from Ortho Bullets or AOS book. Both these sources have been shared on the Target Ortho group. Even if not shared, you put in a request, Priyanka will add on them again and share it with you. But yes, do focus on revision, because, keeping things in mind at this age is very difficult when you have so many other commitments. So make sure that you watch those lectures at 2x speed to revise them again before you sit in the exam. 2 or 3 revisions, good enough, good enough. Yes, the golden part. How best to use Target Ortho for this goal? So please be clear, what is Target Ortho offering you? First of all, we've been specifically focusing on the previous year questions that, I personally and my colleagues have been trying to collect on a recall base. Well, you might not find the question exactly as it came in the exam, because that kind of recall is hard to collect. But at least we've been trying to ensure that we cover up the topic thoroughly. And that is why the explanations, they are just like explanation of a topic, not a question. So those explanations will be very high yield, and very important, will be very accurate. I take help from the students in writing these questions. I give them the work, they write it down. But until unless some faculty has made sure to cross-check everything, they're never put on the website. So you'll find very less mistakes. And I would say that our students have been worth enough to get those mistakes corrected by sharing them on group, and we make timely corrections. It's not just about PYQs. There are many new questions also on Target Ortho to make sure every subject and every topic is covered. So the questions are designed touching every area that is asked. Now there'll be 2 mock tests coming up, first in first week of January and then in February. Make sure to give these mock tests. A number of repeats from the mock tests have also been seen in these papers, and the mock test will almost give you a real scenario. Well, fortunately, we have very less competitors preparing for the FNB exam, so most of the toppers tend to be eventually associated with us. So mostly what we have seen, the results of Target Author have almost been reproduced in the exams also. Like most of the toppers who appeared in the interview with me were also in that list of the mock test toppers, somewhere in the top 10. Okay. Target Author has pretty much been a time tested. Last 3 or 4 years, we've had at least 2 out of every 3 and at least 7 out of every 10. You can trust the material on. The lectures are, focused on covering that exclusive areas like neurosurgery, sports medicine, the areas that you will hardly find any other source for. Okay. The lectures are, designed tackling the FNB exam, and they are very much simplified. And, because they're live lectures, that interaction goes on to remove the general doubts that normally come in your mind watching these lectures. And then, many of us faculty are themselves FNB doctor, which know me, okay, so many. So we know the difficulty level, the problems associated with the exam. So that will give you also an extra edge. The most important part is WhatsApp group. Now, please, guys, don't take it loosely. Don't keep it on that no notification, no disturb mode. Trust me, the last query I answered last year, or I'll go and ask the toppers, that was on prosthetic joint infections. I'd put in that answer and the group was closed with that all the best for the exam. You'll be surprised to know that same question was there in the exam next day. So whatever discussions are going on in the group, take them seriously. Even if you are, walking, moving, doing something, keep on reading the group on and off. Someone might have asked that query, but no one knows that could be a query for you in the exam. That group will give you that, certainly give you that extra edge, and make sure to utilize that group for clearing all the doubts that come your way as you read the question bank or any material on Target Ortho. Uh, by reading those queries that even others have answered, will be getting that constant feeding into your mind, and perhaps with people preparing and sharing doubts, you'll be always staying in a motivated way. If you are motivated, you won't even need leave the job. That adrenaline rush will make sure that despite doing a job, you study 6 to 8 hours on a constant basis for next 8 or 10 weeks, the time that is left for the exam. Very less MCQs in neurosurgery and sports medicine. I agree, Rajesh, but they are specifically covered uh, in that lectures part also. And we'll try having some lectures also from Dr. Mohit. I've already requested him to take some more MCQs. Uh, but somehow the part of neurosurgery that has been asked to you has been very narrow. Bit of anatomy, bit of cranial nerves, bit of vascular related issues, and bit of tumors. So that is very well covered over here. If not direct MCQs are covered, at least that material is covered in the lectures. You would hardly find things coming apart from that. So neurosurgery questions are very basic and from a fixed domain. We are adding up things with time, okay? But whatever is still there is good enough. Getting it. So, okay. When are the two mock tests? So, Kapil, that will be put on the group very shortly. One is around the end of first week of January. The second is around the end of first week of February. So, two mock tests we are aiming before you go into the exam. And mock test will have some new questions also, some repeats also, with that same difficulty level and very good explanations. So make sure that you give that. Okay. And there'll be a detailed assessment, how many people appeared, where did you stand. There's a very detailed assessment that, Sumit will mail you personally for your improvement. Why neurosurgeon ortho? Well, Vipin, spine is an FNB, and neurosurgeons also do spine. So in order to allow those neurosurgeons access to spine, those neurosurgery questions are troubling everyone. But when they're coming in. The best part is that NB also knows hardly a neurosurgeon is appearing for this FNB spine. So the neurosurgery part is kept very basic. It's a very narrow domain from which they ask questions, and they're very basic kind of questions. Like there has been a question on EDH all the 3 years. There has been two questions on anatomy on that skull all the 3 years since last 3 years. So neurosurgery was introduced just 3 years back. Okay. Okay. If someone wants to give FNB trauma, no, he cannot. Chinmay, not possible. Uh, Not possible because the exam is on the same day. So you can choose only one FNB. Okay. And FNB trauma is generally preferred by those people who have not had good hands-on trauma in their PG times. Okay, that's a very popular brand. So people have not had that much. I think good idea to go with FNB trauma, like in places like Rohtak, very good hands-on work. Okay. Any more queries, guys? Any more? So I hope I have been comprehensive enough and elaborative enough as well at times to give you all the necessary information. So any more doubts, guys? So clear with the material today, clear with the lectures, part A and part B. So the lecture is recorded already. This lecture will be recorded and placed on the website for a watch later also. So part A will be 45 minutes, 40 questions. Part B will be 60 minutes, 60 questions. Part A will be general ortho neurosurgery, plus pediatric ortho will be also here and tumors will be also here. Okay. But part B will be specific to that FNB you are giving. Like most people will be giving this FNB. So part B will have only questions from this FNB. Yeah. And then the detailed breakup of the question I've already given. Yes, the past question banks, they are already on the group, on the Target Ortho website. So we have already covered up all the previous year questions, all the records we could collect. And let me tell you, once you guys will just come from the exam, we'll have a discussion and so many things will come up, like what kind of questions were there. So it would not be the exact, questions, but we'll be covering all those topics that were asked. Pediatric ortho topics, Dr. Shalin has been very regular and taking excellent lectures. And then, you can download those PDFs and those notes will be there with you. Okay. So pediatric orthopedics just forms 4 or 5 questions. So not focusing much for pediatric orthopedics for the FNB paper, I would say, guys. Choosing the colleges, there'll be counseling sessions by me. There'll be counseling sessions. I think I already had the notes. So this is that last year counseling session, where you have last year, where you have scopy, what rank, what goes. This will be after the exam. Don't burden yourself right now. Okay. I'll be telling you how round one goes, how round two counseling goes, everything, and how to choose up your field, advantages, disadvantages, and all faculty will be there. Dr. Vishnu will also be there. Dr. Shikha will also be there, helping you out in the counseling session. Don't worry. That preference will help you out with that. Okay. Foot and ankle, very few questions that comes in the trauma part on. Okay. Scope of FNB, I've already told you there. It will be a designated super specialty on your medical council certificates. Teaching experience would not be counted. Now, how you use that up is up to you. But definitely there is some kind of an edge because you're carrying a certificate with a degree. So a degree is always a degree. Yeah, it won't change much your scope. Like there won't be jobs raining to you, but definitely some kind of an edge will be there in a state where there's terrible condition in orthopedics. Time for 100 questions, I've already told you 45 minutes for first 40 questions and then a small break and then 60 minutes for next 60 questions. Sports medicine residency. Well, I think just give the exam and Dr. Shikha will be there in the counseling session to tell you what all comes under sports medicine and all those things that will be discussed. FNB sports medicine is a good field to pick, I would say. You cover up arthroscopy and many things apart from it. Okay. Rank required for Indian Spine Injury Center. So all these things will be covered in the counseling sessions. Okay, this is from the last year, I remember. Indian Spinal Injury Center. Okay, spine. Okay, you're asking me. So it goes below rank 25. So maybe 15, 20 types of ranks. But we discuss it when time comes, the counseling time. Spine fellowship. Well, any fellowship is not better than FNB. You do any damn fellowship, it will never come up on your medical council registration certificate. It's been granted a degree status. Like I cannot get any fellowship registered on my medical council certificate. Okay. So trauma pediatric areas, I won't say important. Just do the target ortho question bank. It will be more than enough for pediatric ortho, spine, foot and ankle, and trauma. But yes, the specialty part you can read from other places. So you won't have much questions from ped ortho, tumors, uh, or the foot and ankle area. There will be 4, 5 questions each. Okay. Overlap of hand questions in general ortho? No, generally not. Hand questions generally remain separate from general ortho. 4, 5 hand questions are there, but out of them also 2, 3 questions are on nerve injuries. Okay, so FNB spine sports medicine will have very less of hand questions. Okay, so I've already told you that fellowship or advanced trauma or FNB will be the better thing to choose. I've already told you the reasons for it, why. And then I have done my FNB, I have done my SRship, I have done my fellowship also from foreign countries. Okay, and what I placed most preference to was FNB because I needed a rank. When I got the rank, I did it. I left my SRship. I completed my SRship after my FNB. So getting FNB will be the toughest because you need to clear a difficult exam. So give it the best preference. Yeah, this time there was less image based in NEET SS, but NEET SS is a very new exam. Very few candidates are giving it. And there are not many seats with good scope in NEET SS as of now. So right now, FNB is a far more developed and evolved exam. Getting it? And that is why the difficulty level is even higher than NEET SS. So expect the images here. Okay. You can prepare for ESS exam. Yes, absolutely right. We see people ask me queries from every corner, every exam, and whatever good questions come to us, go on the group, on the website. So you will have recalls from all exams, the SRship exam, my subject SRship exam, so many others. We keep putting all the good questions. That is how the question bank is increasing. Okay, so you can prepare for all kind of MCQ Qs from the website because we have tried covering all areas. Absolutely not a problem. So any more queries, guys? Okay, so I hope the information has been beneficial to you. So I wish you all the best, guys. Would be looking to see all of you prepare for the mock tests that are coming up, and would be looking to see most of you in the rank holders also after the exam. So I wish you all the best. The session will remain recorded on the website. You can watch it at your ease also. And the group will remain open, WhatsApp group, for any queries. Even if you see in a recorded session, you can ask me and we'll be there to help you out. Right? Sure. All the best, guys. Bye-bye.